So I have started recording. Just it will show.
Now being recorded.
Yes. So should I start?
So it will show on the screen. No, no, sir.
Okay.
Wait for a minute.
Okay.
Yet it has not been started.
Okay.
Okay. So good afternoon to all. Myself, Dr. Jignesh Patel, Senior Lecturer. Welcome to all faculties, alumni and students of BK Modi Government Pharmacy College. Now today's topic of webinar is role and opportunity of pharmacists in PHC, CHC and government hospitals, and which is going to be delivered by Pinakin Jadav sir. Now Pinakin Jadav sir, it is a junior pharmacist at Primary Healthcare Center at Sindhavadar, Health Department, Jilla Panchayat at Morbi. Now, Pinakin sir, it has also worked as an assistant professor in Ajay Thakkar Pharmacy College in Rajkot. Now, I invite Pinakin sir to deliver a talk. Yes, sir. Pinakin sir.
Yeah. Good afternoon, all participants of this webinar. Good afternoon to the principal sir and all faculty of the BK Modi Pharmacy College. I especially thank you have invited me to deliver lecture on this very fruitful topic for the basically DPharm students and all we can say BPharm students who have already you can say part of your institute or either they have passed out from the institute. So as per uh, topic which is very we can say untouchable for the most of our diploma student and basically our degree students who sometimes might not be know that what they have to do or what kind of the roles in the government sector. So today we are just put some we highlight the some of the we can say important points regarding role and opportunity of the pharmacists in PHC, CHC and government hospital. So dear all participants, as you know that pharmacy is a like one of the novel profession and like quality of it is one of the uh, branch which provide a quality services to the society regarding the healthcare uh, in their daily or into their routine lifestyle. So already as you can see on the slide, I have put down we can say some uh, we can say what is the digit what is the word pharmacist tell, that is means pharmacist is a patient patient's person who is H for honest, A for alert, R for researcher, M for motivator, A for administrator, C for courageous, I for intelligence, S for studious and T for thinker. So this terminology for like all alphabet of the pharmacist are rightly are told that tell that what is its motto, what is the vision, and how do we serve to the society in private as well as into the public sectors. Now today I majorly focus onto the uh, basically role of we can say BPharm or DPharm students who have already passed out or might have passed from the we can say respective branch into the health sector and basically the health sector which is linked into the government department means government hospitals. And basically deformed students must know that they have a very precise role and already they have also some sort of the training during their academic season. So they must know where and how to like they can apply themselves, so that's why they get a job and opportunity to serve the society. So let's start first of all with basically into the CHC, means it is a community health center. PHC, that is part of the government primary healthcare system, and government hospitals, means district and sub-district level hospitals, which are the three main area where our students uh, can go and join their duties and can serve. And even though they get a good opportunity to earn the right amount of the salary. So as you can see, like in our government hospitals, PHC and CHC, pharmacist is like a kind of the complete package who is linked with the dispensing, not only dispensing, but lots of the many duties. As you can see in our this presentation, that is a like complete professional person of our healthcare system. Healthcare system is basically made up of the four, we can say, four pillar. One is physician, then pharmacist, then nursing staff, and fourth one is like diagnostic part, that is governed by the laboratory people. So as a pharmacist in hospital, you can provide we can say many important functions. Like first one is obviously we know all that we can say we designing the drug doses forms. Actually it is a not exact part of the government hospital, but in past there is a many pharmacists prepared the dose according to need of the people, and then they are we can say dispense. So that is one of the very important role of the pharmacists in government healthcare system, as well as into private we can say stores. One of the another quality which is like help to deliver the pharmacist for healthcare system in government, that is they have a also good knowledge of the laws and legislation about drugs. That means that include like our jurisprudence part, and basically like some schedules, like schedule X drugs, schedule H drugs, schedule P drugs, where they have to we can say utilize how to utilize that every we can say legislative things of the dispensing of drug, that we know perfectly. So we can betterly once we pass out from this student pass out from the D farm or B farm, then they always whenever they face any prescriptions or medicines which are medicine prescriptions which is given by physician to the patient, they can perfectly deliver the drugs according to the schedules at right time in right manner. And even though they can give counseling to the respective patients who need treatment by that drugs. Another important, we can say, role of the pharmacist in general, that is because of they have a sound technical knowledge of the drugs. Okay, ideally, I have like little bit experience that many of because I am already working in both sector, like in we can say teaching, and as well as like right now I am working in hospitals. So right now in India, physician has a lot of burden, lots of factor they have to we can say control during their OPD sessions. Means they cannot say each and every details to the patient regarding drugs. Obviously, they have better knowledge of the diagnosis, and they can write down the like list, or we can say specific drug treatment. But to but they cannot able to tell because of the lots of the patients and like big number of OPD in government hospitals. So where pharmacist, if a pharmacist has a sound technical knowledge, then he make a impact on healthcare system. For example, where doxycycline should eat, or where the azithromycin should eat, or where famotidine we have to use. For example, doxycycline should not be taken with milk or milk product, because many times patients are doing such kind of the like we can say uh, they have like food habit of the ingestion of the milk with the Indian food, and that might be interact with the drugs. So this kind of the knowledge that pharmacists must already have, so they can deliver that kind of the counseling let- drug properties and property related effects, and side effect and interaction related knowledge to the patient. So sound knowledge is already we implanted in you. So means most of the uh, B Farm and D Farm students can easily deliver that knowledge to the society during the treatment. We can help them the physicians by providing and conveying that knowledge to the patients. Third or fourth important thing is we have also very sound knowledge of the we can say patient management, accounting of drugs, and even though marketing it means we are potentially uh, help to identify the right kind of the medicines and even the patient counseling. So pharmacists can also give we can say this kind of the services like management of the drugs in hospitals. Accounting means inventory maintenance of the drugs. Inventory it means કે જે દવાનો જથ્થો હોય કેટલો હોવો જોઈએ અને કેટલો ખાલી થાય તો એ પાછો ભરવો. That is also a duty of pharmacists and that delivered by the pharmacists into the hospitals. And obviously patient counsel, which is already we have to do during the dispensing of drugs. And last thing we have also we can say profound knowledge regarding the anatomy and health, even the physiology and pharmacology. So you can perfectly deliver the we can say identify the problem of the patient for prescriptions, and accordingly you can even though guide the patients to we can say modify their habits, and we can say follow the how they and you can also answer them like how they follow the treatment which is written by physician, but they don't have a time to explain to the patient. So these are the main we can say factors via which pharmacists can deliver uh, their duties into the government hospital. Like they are we have lots of liberty in government hospital. Like in private hospitals, most of time physicians are dominant, but into the government hospital, physician and pharmacists are work as a group, and they can even though sometimes understand our explanation regarding the drug property, the side effects and their adverse effects, and which he or she might be forgotten during the we can say write down of the prescription. Next important thing already there is a sub definitions are given into the various literature, so that I have put down here that into the healthcare system pharmacist is one of the licensed persons who can deal with the drugs, means who is engaged with the pharmacy by four things like dispensing of drugs, monitoring of drug interactions, administration of vaccines, and counseling of the patient. Yeah, one thing that is third point is very important, that is administration of vaccines. We are not directly linked with the vaccine injections into the patient, uh, but into the government hospitals we stored, and even though we maintain the property of vaccines, and even though we explain our nursing staff that how do and where to administer the right vaccines at right time. In current COVID era, most of time pharmacists and physicians, most of time pharmacists are making all of these things how to administer, whether that vaccine is properly stored or not, whether it's why some, if there is some kind of the adverse effects, then why that all can be we can say that kind of a problem can be solved by pharmacists in government hospital along with the physician. So that is also one of the we can say point I have to we can say recall in this particular current season. uh, Next thing is basically in our government hospital, major object of the pharmacist is that to provide the right drugs to the right patient at right time in right dose through the right route in right way. This is our motto in government hospital. Basically, we have a once we enroll into the this kind of the institutions like government hospital or PHC or CSC, then that is our major motto whenever we join such kind of the duty. So that very easily you all peoples can deliver into the government hospital. So basically, like already I have mentioned that in our government healthcare system, four like basically pillars of whole system, that is a pharmacist, physician or doctors, nursing staff, and lab technician. Uh, they all work, we can say, hand to hand into the PHC, even though into the CHC, and even though into the we can say government hospital. uh, Basically like doctors in PHC means primary health center or MBBS, or we can say sometimes IUS medical officers are also there. Most of time into the CHC, the physicians are MS or MD even though available right now, and even though district hospital and basically sub-district hospital also has like MSMD facility, so they all are part of this team. Pharmacy is always like two kind of they have duty. One is like housekeeping of the medicines, maintain of the inventory, and their like dispensing also. uh, Third pillar is nursing staff. So nursing staff is always there into the PHC. There is a FWs and GNFs. In basically CHC there is a GNFs, and in case of the GH, government hospitals, there is a we can say BS nursing staff, and lab technician is a fourth pillar who who help to the doctors in case of the testing of the patient's sample specimen, and they tell like they help to diagnose the disease. Now, uh, up to here, I have just included the overview of the pharmacist duty into the primary health center, then we can say CHC means community health center, then district hospital, sub district hospitals, uh, and basically these are the major points where like as a part of the healthcare team we provide we can say a better healthcare facility to the we can say people who are not even the effort can do effort to effort for the like can say very higher hospitals or private hospitals. So where there is a like very this is like very humble duty in government sector. Now, in government hospitals, these are the level of infrastructure. Basically, this level is set up by the government of India, and most of states are following this kind of the healthcare facilities. Means કે જે ટૂંકમાં જે ટ્રીટમેન્ટ છે deliver કરી શકે એવી facilities છે, that is like established by government, and that is follow and obeyed by the all the we can say states into the India. So as you can see in this slide, in our state, we have five, six levels of the healthcare facility. First one is a sub center. Obviously, there is no right now because any enrollment of the any pharmacist. The sub center એ સૌથી lower level ઉપર ગ્રામ્ય level ઉપર અને પેટા ગ્રામમાં healthcare facilities આપતા હોય છે. But at that point, still like there is a no we can say any post of the pharmacist. So that is a one of the liquid of the government. Second step is a primary health center. Primary health centers are mostly situated into the we can say some of the rural area, and it is like small we can say hospital which can try to serve some of the we can say primary treatment along with we can say preventive program management, and some of the we can say primary we can say healthcare facility with some of the primary health facility that is situated always into the one of the we can say biggest villages of that particular town. So જે તાલુકાનો જે મોટા villages હોય એની અંદર primary health centers હોય છે, and where we have a like we can say there is enrollment of the pharmacist. Another one is urban health center that is equal to PHC. Urban health center હોય એ પણ PHC જેવું જ હોય, પણ એ urban એરિયામાં હોય. જે urban area city થી થોડા દૂર હોય અને ત્યાં healthcare facility that is part of city, but it is like far from the center area of the city. So where like urban health center are established, and where also pharmacists, there is a like posting of the pharmacists, and pharmacists are delivering their services regarding dispensing and uh, counseling of the dispensing of the drugs and counseling to the patient according to prescriptions. Another level share like fourth one, community health center, that is like big centers, like that is like constructed by the government of we can say each state, and that is directly governed by the state government, and which is also like a little bit like big hospital, then subdivisional hospitals and district hospitals. Subdivisional hospital has a little bit like more bed facility, and district hospital has like almost like we can say Rajkot Civil Hospital, Ahmedabad Civil Hospital, and we can say similarly Jamnagar Civil Hospital. They all are the district hospital. So in Gujarat, we have like this all steps of the health services infrastructure. But out of that, like sub-center Sivaina, primary urban health center means PHC, UPHC, CHC, SDH અને DH. આ બધા લેવલ ઉપર ફાર્માસિસ્ટનું રિક્રુટમેન્ટ થતી હોય છે, and like every level still like there is a like lots of vacancies are available. So like already like past student from the B Farm or D Farm can apply and can serve to the society via this all positions. So this is like our framework. So I just started with this framework because okay, whenever like any pharmacist student applied for the job, he might be sometime not know like what kind of the role of this all health facility into the government sector. So one by one we will take the each health facility design and our role into the health facilities. There is a like a few other area where also like pharmacist has a like we can say dispensing role and counseling role. That include like ESIC hospitals. Many of you might have heard this. ઘણા બધા જોયું હશે કે આપણે PHC, CHC, UPHC અને ડિસ્ટ્રિક્ટ હોસ્પિટલ સિવાય પણ એક એરિયા છે ESIC, એમ્પ્લોયી સ્ટેટ ઇન્સ્યોરન્સ કોર્પોરેશન હોસ્પિટલ્સ એન્ડ હેલ્થ સેન્ટર્સ. મીન્સ મજદૂર વીમા યોજના છે, એનું એક સેમી ગવર્મેન્ટ ઓર્ગેનાઇઝેશન છે, કોર્પોરેશન છે, that is like directly governed by the we can say uh, uh, with help of the we can say state government and governed by the central government. So ત્યાં પણ દરેક હોસ્પિટલમાં ફાર્માસિસ્ટની એક પોસ્ટો હોય છે, એકથી વધારે according to the size of hospital or health center. So ESIC is also one of the we can say area that is directly governed by the we can say central government, and where we can say pharma student can apply and can serve duty of the pharmacist. Railway hospitals are always there, that is also directly governed by the central government, where also pharmacists will important role of the dispensing, counseling, and maintenance of the drugs which are needed into the hospitals. In SRPL centers and hospitals means that is a reserve police, state reserve police health centers and hospitals are also there, where also pharmacists are appointed and they serve their duties. And military hospitals, obviously, that is directly governed by the state government. These are four options also uh, that a pharmacy student has to be like keep in mind, because okay, this area also where they can apply and they can like join the duties and serve to the society. So થોડું આપણે history જોઈ લઈએ from where like government has started this setup. This is just for the knowledge of the students. Okay, into October 2nd October 1952, this kind of the system first of all into the just independent India we have established by government. So that is like mainly means I am mainly taking a like area of the rural healthcare system. So it was a two-tier system. Two-tier means there is a like some of the district and towns has only hospitals. Below that there is a like still at that times no hospitals and healthcare facilities available. But as you can see that then WHO has organized a World Health Summit at Alma-Ata. That is right now it is known as Almaty, and it is a part of Kazakhstan. At that time, it is part of USSR, uh, where government government of the all countries means part of the we can say United WHO countries has decided that like up to 2000, like each and every people of each and every either it is a developed country, developing country, or we can say underdeveloped country, uh, should be means they have availability of the health facilities. So they have declare a goal of the health for all in up till 2000. And after that, like three tier concepts was implemented by government of India, and according to the guideline of government of India, direct state upon a three tier means three level no healthcare system established કરેલું. Previously like two level no healthcare system was available at means we can say basically secondary and we can say primary and secondary. There is a like very poor tertiary system, but right now government passes three layers mass systems means primary healthcare facility, secondary healthcare facility, and tertiary. So એ ત્રણેય લેવલ ઉપર pharmacist નો drug related જેટલી પણ સર્વિસીસ છે એમાં ઇમ્પોર્ટન્ટ રોલ્સ હોય છે, અને ત્યાં બધા જ pharmacist એની ડ્યુટી સર્વ કરી શકે છે. Okay, this is like some of the data. You can see like source of this data is that is a our we can say NHM website. So it tells like this many number of the healthcare facilities in three tier systems are available in our state only. So you can say like how many like needs means how much needs of the pharmacist students uh, is you can say into the state hospitals. Almost like 9,156 sub-center, where right now there is a no we can say any we can say role of pharmacists, uh, but that is like we will discuss later on. Like there is one issue. So if like all academic we can say scholar, even though our we can say chancellors, vice chancellors, if they are emphasize like role of pharmacists at level of the sub center also, then again like more and more we can say posts can be created at the sub center levels as a community health officer, and where we can also serve as a we can say not only dispenser but diagnostic persons for the primary healthcare problems. Almost 1,477 PHCs are there, means primary health centers. So again, like there is a 30-40% of the these PHCs are still vacant without we can say any pharmacists. And at our time of the we can say enrollment, I have to handle like 4 PHC at a time, and we can say week into the specific week. So એક જ વીકમાં 4 PHC handle કરવા પડતો, એટલી બધી વેકેન્સી હતી. Okay, so then this new government has like deliver and means started to enroll lots of number of the people and pharmacists. So now it ભરાતી ગયા છે, but still like 30% PHCs are vacant, and there are no pharmacists. And so it means obviously like quality of the we can say healthcare system might be deteriorated. So there should be one of the area of the concern. Then 348 community health center, 33 sub-district hospital, and 22 district hospitals are there. This is like data of the 31st March 2020. So after that, like many hospitals has like already get approval from like our recent active BJP government. So it means now we have a like step by step. There is a like a we can say they understand the duty of the pharmacist. Even though COVID era also, there is a duty of the healthcare staff is recognized by the government, and right now they are quickly filling up the vacant position in all of the steps of the healthcare system. So આટલા બધા આપણી પાસે we can say healthcare facilities છે ગુજરાતમાં, and each and every steps have we can say needs of the pharmacist, and ત્યાં pharmacist જઈ અને we can say enroll થઈ શકે. Okay, so as already I have started with a few slides that હેલ્થકેર લેવલ 3 ટાઈપના છે. ઓકે, સો એક પ્રાઇમરી હેલ્થ કેર, દેન સેકન્ડરી કેર એન્ડ ટર્સરી કેર. સો બેઝિકલી સબ સેન્ટર લેવલ ઉપર ફાર્માસિસ્ટનો રોલ હજી સુધી એસ્ટાબ્લિશ નથી થયો, પણ પ્રાઇમરી હેલ્થ સેન્ટર એટલે કે નાનકડા ગ્રામ્ય લેવલના જે દવાખાનાઓ છે એની અંદર પ્રાઇમરી કેર્સ માટે we can say doctors, pharmacists, nursing staffs અને basically lab techs are available and they are like serving their duty. So pharmacists is also there, and uh, means the knowledge of the pharmacy is very easily delivered to the society, and that is like helpful also to the society. And second level is community health center. Primary health center ma most of time nana mota disease hoy like fever, and we can say some of the communicable diseases like malaria, typhoid, without like needs of the too many days of the we can say admission into the hospital. Our primary health centers will deliver the treatment, and if they needs means if the patient ne વધારે treatment ની જરૂર પડે, then they can refer to CHC, sub-district hospital and district hospital. Means that we can refer the patients to second level and third level. ત્યારે કોમ્યુનિટી હેલ્થ સેન્ટર્સ મીન્સ જેને સામૂહિક આરોગ્ય કેન્દ્ર પણ કહી શકાય. પ્રાઇમરી હેલ્થ સેન્ટર્સ આર નોન એઝ લાઈક પ્રાથમિક આરોગ્ય કેન્દ્ર ઇન ગુજરાતી. કોમ્યુનિટી હેલ્થ સેન્ટર્સ જેને સામૂહિક આરોગ્ય કેન્દ્ર કહી શકાય, એ લોકો સેકન્ડરી સર્વિસીસ આપે. મીન્સ સેકન્ડરી કેર મીન્સ સબ ડિઝીઝ વિચ આર out of the we can say boundary or barrier of the primary health center. So like both severe diseases હોય, diabetes છે, cancer છે, then the nanny of the surgeries, some of the accidental injury, postmortems and everything like that is like majorly done by the community health centers, and where also like more than one pharmacists are needed in most of the we can say we can say most of the towns into the Gujarat. So ત્યાં એક કરતા વધારે પણ pharmacists હોય છે. Primary health center level most of એક જ pharmacists હોય છે. Then like we can say higher level, more higher level is tertiary care system, where like we have like our surgical as well as non-surgical treatment, even though like treatment for the chronic disease and long-term disease, even though orthopedic treatment, gynec and all treatments are available. So sub-district and district hospital a mota hoy છે. In next upcoming slides we will see like what kind of their infrastructure. So they are also known as the referral hospitals, like we can say PDU hospital, Pandit Dindayal Hospital, Civil Hospital at Rajkot, that is known as district hospital, and sub-district hospitals like which are situated into the basically Jethpur or like in Wakaner near regions of this. I mean, some of the taluka level હોય છે. Now you can see like we can say after means how this all systems of the government or this all hospitals of the government are looking care of how many population means ક્યાં કેટલી we can say health center, urban health centers અને district and sub district hospitals નું cover up હોય છે. બસ કેટલા patient wise આ ટાઈપના setup હોય છે. So, according to the like guideline of Government of India and Ministry of Health and Family Welfare, આ બધું decide Ministry of Health and Family Welfare Department નક્કી કરતું હોય છે. So, એમની guideline પ્રમાણે like there is a one primary health center should be there for the population of 30 to 30,000 people in normal villages. અને ટ્રાઇબલ ને હિરી એરિયા હોય તો 20,000 પીપલ્સ માટે એક PHC હોવું જોઈએ, પ્રાઇમરી હેલ્થ સેન્ટર હોવું જોઈએ. So એક પ્રાઇમરી હેલ્થ સેન્ટર 30,000 લોકોની પોપ્યુલેશન અથવા પેશન્ટની પોપ્યુલેશનને કવર કરી શકે. Ideally there is a like 6-bed facility to like we can say for indoor patient, and for like 3 to 7 days they can hold out these patients for the treatment for some of the like primary disease like fever and malaria, and even though like some of the basic we can say cough and cold kind of the conditions into the respective towns. Then urban health center પણ હોય છે, that is like near to the like district and town. Urban health center urban area હોય છે, શહેરી વિસ્તારોના દુર્ગામી એરિયા. So ત્યાં most of 40,000ની population દીઠ એક urban health center નું establishment હોય છે, અને almost like any bed capacity 6 beds ની હોય છે. Then CHC are little bit like bigger hospital, that is known as a rural hospital. Means it is known as like one big rural hospital, CHC or community health center. So ત્યાં 30 bed ની facilities હોય છે, અને almost like there is a 80,000 થી માંડી અને 1,20,000 મીન્સ નોર્મલ પ્લેન એરિયા હોય તો મીન્સ ઇટ ઇઝ 1,20,000. મેદાની એરિયામાં 1,20,000 પીપલ્સ માટે એક હેલ્થ સેન્ટર CHC હોય છે. અને હિલી અને ટ્રાઇબલ એરિયા મીન્સ દુર્ગામી એરિયામાં 80,000 દીઠ પીપલ્સ દીઠ એક હેલ્થ સેન્ટર હોય છે. ત્યાં પણ 2 થી વધારે ફાર્માસિસ્ટની જરૂર હોય છે. Then sub-district hospitals are like little bit bigger. એ just sub-district level હોય છે. અને ત્યાં 30 થી 100 બેડની ફેસિલિટી છે. There are like 30 to 100 bed indoor patient facilities in such hospitals. It means like their OPD is quite big, almost like 500, 3 to 500 patient per day. And sub-district means SDH. They are known as SDH, sub-district hospitals. They cover the population of lakhs to 5 lakhs into the some of the sub-district area, like bigger towns. Like for example, in case of the Jaipur, we have a like sub-district hospital at Gondal, or sub-district hospitals which are available in Vakane. So means these are the like we can say semi-big hospitals into the district region. And a fourth, like tertiary care, my second last level, say that is the district hospitals. They have like 100 to 500 beds facility for indoor patients, and they are like taking care of all chronic disease, even the HIV and cancers also. And they cover up the population of 5 lakhs to almost like 30 lakhs to almost 15 lakhs. So means ઘણા મોટા મોટા districts means bigger districts માં 50 lakhs સુધી પણ population cover કરતા હોય છે અને all chronic disease નું treatment કરતા હોય છે. Now basically we will start the role of pharmacist. Means basic main area where like it is like dispensing is a major concern area where pharmacists can serve their duty. But apart from that, like various programs and all other duties are also we can say there into the PHC, then CHC, and sub-district hospitals and district hospitals. So આ બધા લેવલ ઉપર pharmacist dispensing drug dispensing સિવાયની પણ ઘણી બધી duties હોય છે. And if you know these roles and duties at this particular means each level, and like it is very easy to you to understand. It is very easy to understand all the students like where they can apply their knowledge, and they are like crack some exams and showing there. So like basically at the PHC level, main duty is OPD and IPD, means outdoor patient and indoor patients ne drug dispensing, patient counseling કરવાનું હોય છે. That is the main prime role. But apart from that, like primary health centers are also governing some we can say preventive program which prevents the disease progressions into the community. Means communicable disease હોય like COVID પણ એક એમાંનો જ છે. Like TB, મલેરિયા કેવા જે બેઝિક રૂરલ પ્રોબ્લેમ્સ છે એના જે પ્રિવેન્ટિવ પ્રોગ્રામ્સ છે એ પણ PHC ચલાવતું હોય છે અને ગવર્ન કરતું હોય છે. And basically like our medical officers are governing head of this, like means monitor of this whole program, and he like basically taking help of the pharmacist. So pharmacist એ દરેક most of programs ની અંદર પોતાનો we can say disease monitoring and prevention of disease માટે પોતાનો રોલ આપતું હોય છે. So one is the national immunization program, means vaccination program into the most of time children's, infant, neonates, and as well as into the mother. The national immunization program world ની અંદર સૌથી બેસ્ટ પ્રોગ્રામ ઇન્ડિયા દ્વારા ચાલે છે, મીન્સ કે વેક્સિનેશન પ્રોગ્રામ. So a program ની અંદર pharmacist નો important role એ હોય છે કે like they like we can say maintain the stock, preserve the vaccine, and deliver the like proper vaccine with the proper potency to their nursing staff. So that's why they can be rightly handle that vaccines and immunize the we can say children and mother as well as the neonates. So a બહુ important program છે and one of the like we can say most successful program of the India. Already like via this kind of the program, government of India has eliminated polio from our country. The next important area is TB and leprosy at the rural level. So where also pharmacist has a like duty to monitor the such patients treatment and like control the treatment and whether and counsel the patients. That is like major area. So TB and leprosy એક major area છે. એ પ્રોગ્રામમાં પણ ફાર્માસિસ્ટની ડ્યુટી હોય છે. દેન NVBDCP મીન્સ નેશનલ વેક્ટર બોર્ન ડિઝીઝ લાઈક મેલેરિયા, ડેન્ગ્યુ, ચિકનગુનિયા, એ જે વેક્ટર મીન્સ કે મચ્છર અથવા કોઈ વાહકથી જે ફેલાતા રોગો હોય છે એ ટ્રીટમેન્ટ રિલેટેડ ટાસ્કમાં પણ ફાર્માસિસ્ટનું મોનિટરિંગ અને ડિસ્પેન્સિંગ રોલ હોય છે. દેન એવા નંબર ઓફ પ્રોગ્રામ્સ છે લાઈક નેશનલ ડીવોર્મિંગ પ્રોગ્રામ મીન્સ બાળકોમાં કૃમિ એટલે વોર્મ્સનું ઇન્ફેક્શન રોકવું. યરલી 2 વાર પ્રોગ્રામ ચાલતો હોય છે. નેશનલ પોલિયો પ્રોગ્રામ ઓલરેડી યુ નો લાઈક ઇટ ઇઝ વેલ નોન પ્રોગ્રામ એન્ડ established program of the government of India. નેશનલ ડાયાબિટીસ એન્ડ કેન્સર ડાયગ્નોસિસ પ્રોગ્રામ એ પણ ફાર્માસિસ્ટ ડ્યુટી છે લાઈક ઓપીડીમાંથી એવા પેશન્ટ જે કન્ટિન્યુઅસલી ટ્રીટમેન્ટ માટે આવતા હોય અને એબનોર્મલ ડાયાબિટીસ કે મેટાબોલિક ડિસીઝ પ્રોફાઇલ દેખાડતા હોય તો એને પ્રોપરલી વી કેન સી ગાઈડન્સ આપવું અને રેફર કરવા. And same way, like there is many programs, so I have just highlighted main one where pharmacist has this like particular role. Same way, national HIV prevention program is also there where we make awareness and counsel the patients during our dispensing time uh, to like how prevents this kind of the like infectious disease like means non-curable and even the infectious disease via the some of the we can say preventive devices like family planning preventive devices. We can like explain them and try to like we can say follow that kind of the processes. And then into the COVID also we are like counsel the many of the people regarding vaccination and as well as like we can say preventive step means mask, face masking, sanitizer, hand sanitizations, and as well as social distancing. So એ પણ ફાર્માસિસ્ટો કરતા હોય છે. while DH, SDH, CHC and CHC માં બીજા બધા રોલ્સ છે એમાં pharmacist DH, SDH અને CHC એમાં મોસ્ટ ઓફ ફાર્માસિસ્ટનો ડિસ્પેન્સિંગમાં અને કોલ્ડ ચેઇન મેનેજમેન્ટમાં રોલ હોય છે. So that roles also means that area also I have covered. Like first prime is like DH, SDH and CHC માં dispensing no burden ઘણો બધો હોય છે. Almost like 500 patients per day or more than 700 to 800 patients per day for dispensing. So ત્યાં dispensing and counseling બહુ difficult હોય છે. So more than one patient pharmacist available હોય છે. The second is cold chain management. Whatever I have talked already in PHC level, that is a like national immunization program. So vaccine distribution and their management, that is known as cold chain management, means and proper temperature પર રાખી and deliver કરવું. That is also one duty of the pharmacist. Then drug inventory management means government of India has made a list of the essential drugs, means સૌથી જરૂરી rural and urban area ની drugs કે જે જેનરિકમાં અવેલેબલ હોય લિસ્ટ મેન્ટેન રાખવું મીન્સ એનો સ્ટોક મેન્ટેન રાખવો અને ડિસ્પેન્સ કરવું એ પણ ફાર્માસિસ્ટની જવાબદારી છે મીન્સ એનું રેકોર્ડ કીપિંગ ને ઓલ ઓફ ધેટ. I will show in next upcoming slide like how we are maintaining that or records. પછી management of 99 dots therapy for TB patients means 99 dots therapy is a novel we can say applications for TB patient means treatment applications for TB patient means daily treatment regime TB patient ના આવી ગઈ છે. That is like we manage, we govern the like whether patient daily drug લે છે કે નહીં અને એ drug આપણે એને time to time આપીએ એ આપણી duty હોય છે. Then leprosy control program provide medications for like 6 to 8 months. It is like longer treatment, so where monitoring and medicines delivery of we can say dispensing of medicine is also one of the problem, so which is delivered by the pharmacists at DH, SDH, CS and PHC level. Then medical equipment, obviously like we also keep a record of maintenance of all medical equipment like oxygen devices. Already you know like in corona there is like lack of oxygen devices, so we keep informations and well maintain this all equipment and well prepared like everything, so that's why our doctors and nursing staff can use very well. So we manage them and record them in our PHC, CSC, SDH and DH. And family planning related like guide we can say medicine and device distributions and accounting is also we can say managed by the pharmacists at each of these 4 level in government sector. Okay, we rapidly go through the like some of the e-management system right now, and this new government has given to us in given to the pharmacists to like improve the healthcare system. So આટલા બધા e-management system પણ ગવર્મેન્ટ હવે આપે છે કે જે સોફ્ટવેર છે કે પ્રોગ્રામ્સ મોબાઈલ અને કમ્પ્યુટર બેઝ છે જેના દ્વારા ગવર્મેન્ટ વાયા pharmacists can manage like disease prevalence, drug accounting, and vaccine accounting and equipment management and all functions of the like hospitals like TB management and all things. So you can see like ઘણા બધા સોફ્ટવેર પણ અમારી પાસે અવેલેબલ છે. લાઈક ઓપીડી હોય તો એની અંદર કયા ટાઈપના ડિઝીઝ વાળા પેશન્ટ આવે છે એકાઉન્ટિંગ આઈડીએસપી સોફ્ટવેર દ્વારા થઈ શકે. સો એની અંદર મેજર હેલ્થ પ્રોબ્લેમ્સ લાઈક વી કેન સે ફીવર હોય, એન્ટ્રિક ફીવર હોય, પછી લાઈક એનિમિયા હોય, we can say typhoid, kind of the fever હોય કે જે કોમ્યુનિકેબલ હોય, મેલેરિયા હોઈ શકે. પછી કરંટમાં આઈએલઆઈ મીન્સ we can say acute respiratory infections, એ પણ that is like covid and swine flu that are also kind of the infections. Then accounting પણ IDSP સોફ્ટવેર દ્વારા કરી શકીએ છીએ. મીન્સ ઓપીડીમાં જે પણ પેશન્ટ આવતા હોય અને આપણે સિસ્ટમમાં નાખી દઈએ તો ગવર્નમેન્ટને ખબર પડે કે ભાઈ આટલા પેશન્ટ આવે છે. Another we can say e-management system is e-ઔષધિ. e-ઔષધિ એક એવો પ્રોગ્રામ છે જે ડ્રગ્સ ડિસ્પેન્સિંગ અને એનું ક્વોન્ટિટી આપણા પર્સનલ સ્ટોરમાં કેટલી છે અને આપણે ડિસ્પેન્સ કરીએ ઓટોમેટિક ડિટેક્ટ થાય એ સિસ્ટમ છે જે પ્રાઇવેટ મેડિકલ સ્ટોર્સમાં હોય છે. એ ટાઈપનું સોફ્ટવેર પણ હવે ગવર્મેન્ટમાં અવેલેબલ છે. e-ઔષધિ દેટ ઇઝ લાઈક ડ્રગ મેનેજમેન્ટ ઇન્વેન્ટરી ડિસ્પેન્સિંગ મેનેજમેન્ટ સિસ્ટમ, જેમાં પેશન્ટ રેકોર્ડ્સ અને ડ્રગ રેકોર્ડ્સ પણ રહી શકે, સ્ટોક રેકોર્ડ પણ રહી શકે. One of the like very familiar software is also the EV, ઇલેક્ટ્રોનિક વેક્સિન ઇન્ટેલિજન્ટ નેટવર્ક સિસ્ટમ છે જે આપણને સોફ્ટવેર આપેલું હોય છે ફાર્માસિસ્ટને કે જે ઇલેક્ટ્રોનિકલી કેટલું વેક્સિન ક્યાં કયા પેશન્ટને કેટલી કયા દિવસે મારેલું છે એનું આખું મેનેજમેન્ટ કરી શકાય. અને એમાં જે મેઇનલી ફાર્માસિસ્ટ છે એ જ એમાં ઇનપુટ આપતું હોય છે. સો that is like purely governed by e-ઔષધિ even purely governed by the pharmacist into the PHC, CHC, DH and SDH. And EMS is another software જે equipment maintenance and management માટે આપણને હેલ્પફુલ થાય છે. મીન્સ ત્યાં બધા આપણે ઇક્વિપમેન્ટ નાખી દઈએ તો એની એક્સપાયર એનું જે પ્રોબ્લેમ્સ છે એ બધા આપણે ડાયરેક્ટલી ગવર્મેન્ટ ઓફ ઇન્ડિયાને કોડ કરી શકીએ અને મેન્ટેનન્સ પણ ગવર્મેન્ટ કરી આપે. સેમ વે FPLIMS મીન્સ ફેમિલી પ્લાનિંગ લોજિસ્ટિક મેનેજમેન્ટ સિસ્ટમનું એક સોફ્ટવેર છે જે ફેમિલી પ્લાનિંગના ડિવાઇસીસ હોય લાઈક કોપોર્ટી એન્ડ પિલ્સ લાઈક માલાયન એન્ડ અધર્સ, એ બધાનું એકાઉન્ટિંગ અને કયા પેશન્ટને મળે છે એ મેનેજ કરી શકે. સો એ સોફ્ટવેર પણ ફાર્માસિસ્ટ હેન્ડલ કરતા હોય છે. Nixa is one of the very important software of the PHC, CHC and all STH that is like taken care of the TB treatment. Daily patient અત્યારે એવી સિસ્ટમ છે આપણી પાસે કે પેશન્ટે જ્યારે ડ્રગ લે તો ડેઇલી ડ્રગ લેવાની હોય 6 મહિના કે 8 મહિના સુધી, અને એની ટેબ્લેટ્સ છે એ we can say પ્રીફિલ સેચેટમાં આપેલી હોય. સો એ પેશન્ટે ડેઇલી એ ડ્રગ ખાય અને મિસ કોલ કરવાનો હોય. મિસ કોલ છે આપણને હાજરી આપે કે આજે આ પેશન્ટે દવા ખાધી છે. તો ડેઇલી મોનિટરિંગ એ ટીબીમાં બહુ ઇમ્પોર્ટન્ટ છે. દેટ ઇઝ લાઈક વન ઓફ ધ ઇમ્પોર્ટન્ટ સોફ્ટવેર લાઈક નિક્સઈ that show us like whether the patient has taken that medicines or not. અને નિક્સઈ ઔષધિ પણ એવી જ એક સોફ્ટવેર છે જે આપણી જે ટીબીની મેડિસિન્સ હોય છે એનું એકાઉન્ટિંગ અને ડિલિવરી માટે હેલ્પફુલ થાય છે. સો મીન્સ હવે ગવર્મેન્ટમાં પણ આ ટાઈપની ઈ મેનેજમેન્ટ સિસ્ટમ્સ અવેલેબલ છે via which our work is like now very less as compared to the in past, because પહેલા લખાપટ્ટી હતી, હવે નથી. Last few things like કોણ એપ્લાય કરી શકે. So basically there is a two posts, junior and senior pharmacist, and both have a similar kind of the qualification. So whenever you need to apply or whenever you want to apply into this all four sections means government hospitals or either sub-district hospitals or either CHC or even though primary health center or either we can say ESIC hospitals or railway hospitals, બધે જ ડીફાર્મ ફાર્માસિસ્ટનું ક્વોલિફિકેશન જે જરૂરી હોય એ બેઝિક ડીફાર્મ છે. Those students who have already passed out DPharm, then they require 2 years of the experience, means DPharm degree plus 2 years of experience in government or non-government sector hospitals. But right now interview time government sector hospitals ના experience ને prioritize રાખવામાં આવે છે. જેથી કરીને candidate select થાય તો government hospital ના contract base ઉપર work કર્યું હોય તો that is like a good candidate for selection. Second, BPharm candidate directly go into this profession without like any kind of the experience, and both level of state pharmacy council registration necessary છે. newer opportunity per se, almost like most of our participants might be a B Farm or D Farm students. But if there is like any M Farm student, means M Farm in Statistics QA or pharmacology or like other branch, so they can go into the EVIN program. EVIN program is basically, already I have talked, like it is we can say electronic vaccine intelligent network, which manage the vaccination throughout the India at each level from rural to urban. So એ સોફ્ટવેર છે એ નેશનલ હેલ્થ મિશનની અંડરમાં ડેવલપ કરેલું છે અને આખો પ્રોગ્રામ નેશનલ હેલ્થ મિશન ગવર્ન કરે છે. સો સ્ટેટ ગવર્મેન્ટ એમાં ફંડિંગ પણ કરતું હોય છે. એમાં એમફાર્મ ગ્રેજ્યુએટ્સની નીડ્સ છે. એન્ડ ઇફ યુ આર એમફાર્મ પ્લસ PhD, then you can become a like we can say district manager, or we can say state manager, who govern the event program, or work as a event program coordinator at the state level. So a પણ opportunity છે. And another one is like RBSK program pharmacist, means RBSK means રાષ્ટ્રીય બાલ સુરક્ષા કાર્યક્રમ. એ પ્રોગ્રામમાં પણ B Farm અને D Farm ગ્રેજ્યુએટ્સને લેવામાં આવે છે. And their basic duty is like to take care of the uh, uh, school that is like come under the school health program. So જેની અંદર સ્કૂલે જતા બાળકો હોય, હેલ્થ ચેકઅપ અને એને ડ્રગ્સ ડિલિવરી કરવાની હોય, એની અંદર ફાર્માસિસ્ટનો રોલ હોય છે. મીન્સ he count the health of the like that children's, and as well as dispense the drugs. So ત્યાં પણ contract right now NHM means National Health Program is running this post via contracted basis. So contracted basis ઉપર પણ એ પણ લઈ શકાય છે pharmacist ને as a duty તરીકે. And as I can also, most of participants may have interest like ત્યાં ક્યાં apply કરવું, કઈ રીતના apply કરવું. So most of this post has a like written exam, and like for CHC means community health center, district hospital, sub district hospital, and railway hospital, ESIS. Means આટલા હોસ્પિટલ્સ છે અને જીપીએસસી એક્ઝામ થ્રુ મીન્સ એનરોલમેન્ટ થાય છે. રેલવે અલગ બોર્ડ છે જે પોતાનું એક્ઝામિનેશન કન્ડક્ટ કરી અને written exam લેતી હોય છે. Written exam is MCQ exam હોય that you have to crack down, and you can directly select it without interview. There is no need of the interview in this all positions. PHC level ઉપર એકચ્યુઅલમાં એ જિલ્લા પંચાયત ના અંડરમાં આવે છે. સો GPSSB means જિલ્લા પંચાયત recruitment board છે. That is like taken means they are like conducting the exam, so student can also apply there and like can be become a part of the PHC pharmacist profession. And ESIC માં પણ એ લોકોનું ઓન એક્ઝામિનેશન હોય છે. સો મીન્સ એ મોસ્ટ ઓફ આપણે ઇન્ડસ્ટ્રીયલ એરિયામાં હોય. હવે લાઈક અમદાવાદ, લાઈક we can say to GIDC area of the Bhavnagar, GIDC area of the Rajkot, GIDC area of the Morbi, etc. etc. means even the Baroda and Surat. So એ પણ બહુ સારી ઓપોર્ચ્યુનિટી છે. મીન્સ મોસ્ટ ઓફ સિટીના નિયરબાય એરિયામાં હોય છે જ્યાં ફાર્માસિસ્ટ હોસ્પિટલ્સમાં ડિસ્પેન્સિંગ અને એકાઉન્ટિંગ ઓફ ડ્રગ્સ રાખતા હોય છે. સો એ લોકોની પણ એક્ઝામ છે. સો આ મેજર 3 એક્ઝામ્સ છે જે તમે મીન્સ યુ કેન લાઈક ટ્રાઈડ મીન્સ પ્રિપેર્ડ betterly than tried. Most of time is a very simple thing. Most of our like syllabus covered for this preparation of the syllabus is covered in for this particular examinations. And once you have a like better knowledge of all our subjects, pharmacy, like pharmacology, pharmaceutics, quality assurance, drug dispensing, jurisprudence, and that basic knowledge is enough for crack down this examinations. So thank you. Happy Teachers Day in advance because yesterday, tomorrow we have a Teachers Day. So teachers protected and like prepared this kind of the webinars. So and they are like give you all of the participants an opportunity to hear a number of the speakers who are already working in field and to gain their experience, and that might be helped to crack the exam, to be become a part of such organizations and deliver your duties. Thank you.
Okay, thank you, sir. Now question answer session is open. So if any students have the doubt, they can ask the questions to sir.
My sir green.
They can ask. Pinakin sir, there is one question from my side.
Yeah.
Sir, what is the minimum qualification for senior pharmacist or experience? If is there any experience is required for senior pharmacist?
Uh, right now it is like this that post is mostly like a promoted post, so means a promotion થી જ મળતી હોય છે. પણ જ્યારે પ્રમોશન થી પણ અવેલેબલ ન હોય એ પોસ્ટો ના ભરાય, કારણ કે ઓલરેડી લાઈક જુનિયર ફાર્માસિસ્ટની જ વેકેન્સી એટલી બધી હોય છે કે દરેક ડિસ્ટ્રિક્ટ હોસ્પિટલ્સ
Okay.
and promote the all pharmacists. So એ ટાઈમે એવું થાય કે મોસ્ટ ઓફ એ પ્રમોશન બેઝ પોસ્ટ છે, મીન્સ મિનિમમ 5 યરની સર્વિસ જોતી હોય છે. બટ એવું હોતું નથી, ઘણીવાર ડાયરેક્ટ પણ રિક્રુટમેન્ટ થાય છે, સીધી જ જીપીએસ એક્ઝામ લઈ અને સિનિયર ફાર્માસિસ્ટની પોસ્ટ ભરતા હોય છે અને ભરે જ છે.
Okay. So what is the qualification for senior pharmacist for that? It is diploma pharmacy or BPharm?
No, diploma pharmacy with minimum experience of 5 years, but already waiting એટલું બધું હોય છે કે
Okay.
જેમ જેમ મોસ્ટ એક્સપિરિયન્સ પર્સન હોય એને પહેલા વારો આવે, Means કે લાઈક 20 યર પણ ઘણા જુનિયર ફાર્માસિસ્ટ તરીકે વર્ક કરતા
Yes,
હોય,
yes,
and
yes,
then
yes.
vacancy they got a promotion.
Okay. And what is the syllabus? Means general knowledge is there or not? General knowledge and mathematics and grammar.
એક્ઝામની અંદર બેઝિકલી બહુ સિમ્પલ છે. મેં જેમ કહ્યું બેઝિક જે નોલેજ હોય એટલું ઇનફ છે જે ફાર્મસી રિલેટેડ હોય. પ્લસમાં તમારે રિઝનિંગ અને મેથેમેટિક્સમાં થોડું ફૂલ નોલેજ હોવું જોઈએ, અથવા પ્રિપરેશન પણ અલગથી કરવી જોઈએ. અને થર્ડ થિંગ જનરલ નોલેજ. ઓકે, આઈડિયલી કેવું હોય કે લાઈક દરેક પ્રોફેશન હોય તેની અંદર જે પ્રોફેશનલી તો બધાનું નોલેજ સાઉન્ડ જ હશે, જે ફાર્મસીનો હશે બધા સિમિલર ભણેલા હશે, બરાબર. પણ
Yes,
મેથ્સ,
yes.
રિઝનિંગ અને જનરલ નોલેજ એઝ વેલ એઝ ઇંગ્લિશ, આ 4 પોઈન્ટ એવા છે કે જેની અંદર તમારે એક્સ્ટ્રા વર્ક કરવું પડે, અથવા મીન્સ એક્સ્ટ્રા એફર્ટ લગાવવો પડે, જે અને એ બેઝિક જ હોય છે. રિઝનિંગ હોય એ બહુ સિમ્પલ લોજિસ્ટિક ક્વેશ્ચન હોય છે, એટલા બધા કાંઈ આઈએસ લેવલના હોતા નથી. સેકન્ડ મેથેમેટિક્સ મીન્સ 1 થી 10 ધોરણનું જ મેથેમેટિક્સ હોય. અને થર્ડ થિંગ ઇંગ્લિશ પણ 10 ધોરણ સુધીનું ગ્રામેટિકલ અને લેંગ્વેજ જ ઇંગ્લિશ હોય છે. સો આપણે ફાર્મસીને તો ઇમ્પોર્ટન્ટ આપીએ જ એક્ઝામ ક્રેક કરવા માટે, પણ જે 60% સિવાય 50% રાઈટ નાउ 50 છે, પેલા 60-70% ફાર્મસીના જે સિલેબસને એનરોલ કરતા હતા એક્ઝામમાં, 30% મેથ્સ, રિઝનિંગ, ઇંગ્લિશ રાખતા હતા. પણ રાઈટ નાउ એવું રહેશે કે 50% સિલેબસ ઓફ ધ ડીફાર્મ ઓર બીફાર્મ, પ્લસ મોસ્ટ ઓફ બીફાર્મનો જ આવશે, કારણ કે હવે તકલીફ કેવી હતી કે બીફાર્મ વાળા પણ એક્ઝામ આપતા હોય છે. તો આખો
Yes.
સિલેબસ બીફાર્મ
Yes.
લેવલનો હોય છે.
Students are also
પ્લસમાં
going for
બાકીના
exam.
50 રિઝનિંગ અને ગ્રામર પ્લસ ઇંગ્લિશ પ્લસ જનરલ નોલેજ, આ 4 પોઈન્ટ્સ હોય છે. તો આ 4 પોઈન્ટમાં ફ્લુઅન્સી હોય છે, બાકી બધામાં
Okay.
બધા નહીં હોય, બરાબર. એમાં થોડું ઘણું એકાદ બે પોઈન્ટ આગળ, એકાદ બે ક્વેશ્ચન આગળ પાછળ થઈ શકે. હોશિયાર હોય તો પડે ને 3 ખોટા પડે કે 4 ખોટા પડે. પણ જો જીકે, મેથ્સ, રિઝનિંગ જો પાવરફુલ હોય તો તમે બીજા કરતા વધારે માર્ક્સ લાવી શકો. સો આ ટ્રેનિંગ કોઈ આપતું નથી. એમ આઈડિયલી જે આપણે ફાર્મા ઇન્સ્ટિટ્યુશન હોય એ ટૂંકમાં ટીચિંગ ફાર્મસી ફિલ્ડનું તો કરી જ આપતા હોય. સ્ટુડન્ટે એક્સ્ટ્રા એફર્ટ પણ લગાવવો પડે. એવું નથી કે બધા કોલેજમાંથી જ બધા ઇન્ફ્લુઅન્સ મળી જાય.
Yes, yes.
Go to base of the maths, go to background of the grammar, go to background of the GK, and take knowledge from there. મીન્સ આપણે ટેક્સ્ટ બુકમાંથી જે નોલેજ હોય છે, એના માટે કંઈ ટીચરની એફર્ટની જરૂર નથી હોતી.
Another question is that what is the role of pharmacist in immunization, vaccination?
બેઝિકલી એકાઉન્ટિંગ એ મેજર ઇશ્યુ હોય છે, બાકી
Yes.
બહુ એડમિનિસ્ટ્રેટિવ કોઈ ઇશ્યુ હોતા નથી. બટ જે ડ્રગ્સ મીન્સ વેક્સિન્સ છે એને પ્રોપર પોટેન્સીમાં અને સ્ટેબિલિટીમાં રાખવી એ બહુ ઇમ્પોર્ટન્ટ છે. કે દરેક વેક્સિન્સ વાઇઝ ઉપર એક વીવીએમ લેબલ હોય. વીવીએમ લેબલ છે ટેમ્પરેચરમાં જો વેક્સિન્સને રાખીએ તો મીન્સ એની પોટેન્સી લોસ થતી જાય. સો એને પ્રોપર 2 થી 8 ડિગ્રી જે ટેમ્પરેચરની આઈડિયલ રેન્જ હોય છે મોસ્ટ ઓફ વેક્સિન માટે, એ મેન્ટેન રાખવી, એ ડેઈલી ટુ ડેઈલી અમારે ઓબ્ઝર્વ કરવું પડે. ડેઈલી સવારે 10 AM અને સાંજે 4 PM we have to note down the temperature of our like devices. Means ILR એક ડિવાઇસ છે, એક ટાઈપનું
Okay.
ફ્રીઝ છે જે 48 અવર સુધી વેક્સિન્સને વિધાઉટ લાઇટ પણ હોલ્ડ કરી શકે. અને બીજું છે કોલ્ડ ચેઇનમાં આપણે મેન્ટેન રાખવું. કોલ્ડ ચેઇન મેનેજમેન્ટ એ એવો પોઈન્ટ છે કે જેની અંદર લાઈક એ નર્સિંગ સ્ટાફ છે એ લોકો ખાલી લેમેન તરીકે વર્ક કરે છે. એ લોકોને જે આપણે ગાઈડ આપીએ કે ભાઈ આ વેક્સિનને 0.5 ml આપવાનું એટલે આપી દો, કેવું વેક્સિન છે કે કેવી ક્વોલિટી છે કે એવું બધું એ લોકોને ખબર નથી હોતી. સો મીન્સ આપણે પ્રોપર સ્ટાન્ડર્ડમાં રાખીએ વેક્સિનની મીન્સ પોટેન્શી, સો એ રાઈટ ઇફેક્ટ આપે. સો કોલ્ડ ચેન મેનેજમેન્ટનો એક પોઈન્ટ છે કે એક તો એને વેક્સિનને સ્ટોર પ્રોપરલી કરવું અને પ્રોપરલી પહોંચાડવું જે સાઇટ ઉપર, મીન્સ ગામડામાં તો બહુ દૂર હોય,
Yes.
સો વેક્સિન કેરિયર
So
હોય
it
છે
is the
અને
responsibility of
એટલે
pharmacist. ને?
અને અમારું ઇવિન સોફ્ટવેર છે એમાં એવું છે કે મોબાઈલ છે ને એ તમારું ટ્રેક કરતું હોય કે તમારું ફ્રીઝ ત્યાં
Yes.
દૂર પડેલું હોય પણ એમાંથી સિગ્નલ આવતો હોય કે થઈ જાય તો ફાર્માસિસ્ટ કહી દે કે ભાઈ આ બંધ છે, ભાઈ રિપેર કરો અથવા તો ઇલેક્ટ્રિસિટીને રીઇન્સ્ટોલ કરો.
Okay. Now, is there any questions from students or other faculty? Okay, sir. So I think you have covered all the topics regarding the government hospitals. So I am thankful to you, sir, to deliver such a nice, informative, and knowledgeable talk. So on behalf of BK Modi Pharmacy College, I am thankful to you. Now, sir, we will send you the certificate of appreciation in person.
Thank you very much, sir. Thank you to like our principal, Dr. Chawda sir, and the Jignesh Patel sir, the like all faculty member of BK Modi Pharmacy College, because they have given me opportunity after 6 years to deliver a lecture, and already your staff is very like helpful to me into the past. So thank you very much, all of the staff member, our respected principal sir, and all the faculty.
Thank you, sir. So I have shared the certificate link for all the students and participants. So you may fill the details, so you will get the certificate immediately. Thank you, sir. Pinakin, sir. So
Thank you
here
very
we end
much.
our today's session.
Okay, thank you, sir. Jignesh.